5 warning signs of colon cancer you should never ignore. What do King T'Challa from Wakanda Forever, Pele, famous Brazilian soccer player, and Kirstie Alley, famous for Cheers, have in common? The answer? They all died of colon cancer. Hi, I'm Dr. Brian. Today, I'm going to explore 5 signs of colon cancer that you should never ignore. How does colon cancer usually get diagnosed? Well, in the ideal world, it's diagnosed in screening, which means you don't have symptoms, and a procedure like colonoscopy is done, where they find the colon cancer at a stage that it can be easily treated. In the less ideal world, colon cancer might lead to an emergency admission to the hospital. And this is because the colon cancer might cause a perforation in bowel, causes a hole in it, or it might obstruct your bowel, or there might be such quick and rapid, terrible bleeding from the colon cancer that it requires you to go to the emergency room. However, emergent admission and asymptomatic diagnosis are actually not the most common. In 70 to 90% of the cases, colon cancer is actually diagnosed from symptoms. And the symptoms of colon cancer are usually because the colon cancer or the tumor grows into the lumen of the colon, or it grows into adjacent structures. And because of this, unfortunately, symptomatic colon cancer is oftentimes more advanced colon cancer. Now, your colon is shaped somewhat like a picture frame and looks kind of like this. There's a right colon, there's a left colon, here's the appendix, and just before the stool leaves is the rectum. Notice the right colon is actually larger, and the left side is smaller, and the rectum becomes even smaller still. This size differential and the position in the abdomen is important when you start considering symptoms. Sign number 1 that you must not ignore: blood in your stool. This can take 2 forms. One is known as melena. So melena is more commonly associated with right-sided colon lesions. That's because the blood is put into the lumen of the colon, the bacteria act upon the blood and turn it to a different color. So that by the time that you expel it, it's actually no longer red, but black and sticky. Next is hematochezia. This is red, fresh blood like you think of blood, and it is most commonly more from the left colon, and that's because the colon then doesn't have time to break that blood down. It's also very closely associated with rectal or more distal lesions, that is, lesions that are near the end. Number 2 symptom you must not ignore is iron deficiency anemia. This means that you just don't have enough red cells. When you have a routine blood test, your blood count is down. Because this blood hasn't shown up in your stool, this is known as occult bleeding. And over time, having bleeding that's going on can really drop your blood count. For example, literature shows that right-sided colon lesions can bleed up to 9 cc's a day. That might not sound like a lot, but every day, day after day after day, can really lead to a lot of blood loss. For example, over 8 months, 9 cc's a day actually equals an entire gallon of blood. The third symptom you must not ignore is a change in bowel habits. Now, bowel habits include diarrhea, constipation, or a change in your stool caliber. Diarrhea and constipation are really not very specific, but if they go for many weeks or even months, then you really should get them addressed. But change in stool caliber can really be concerning. Again, remember the size of the right and the left colon. If you have a tumor in your right colon, the stool is usually still liquid when it's going through the right side. So this doesn't change your stool caliber at all. But on the left side, where the stool is more solid, now the stool can become ribbon-like or very small. And smaller caliber stools are especially associated with rectal tumors. Now, when you combine some of these symptoms, that is change in bowel habits and specifically change in bowel caliber, and you're having blood in your stool, this is very, very concerning. There's also an additional symptom known as tenesmus. This is the urge that you still have to go to the bathroom even after you've gone completely. This can be painful and feel like spasm, and it can be, again, a sign that you actually have a colon cancer. Now, the 4th and 5th symptom you must not ignore, combined a little bit. So if you're having a long-standing pain, you're having abdominal distension, or that is combined with nausea and vomiting, that can be a sign of underlying colon cancer, because the colon cancer may obstruct the bowel, not enough to put you in the hospital, but it can dilate the bowel upstream from where the tumor is. That can really distend you, cause pain. In addition, that can cause nausea and vomiting. Another common cause of pain with symptomatic colon cancer is when the tumor grows outside the lumen of the colon and moves into and invades something next door. This can be gallbladder, the liver, small bowel. All of that can cause you pain as as well as nausea and vomiting. So remember, symptoms mean probably and unfortunately more advanced colon cancer. So what are some of the other things that would tell you you need to be more concerned about the possibility of you having colon cancer? Well, one of them is a family history of colon and rectal cancer. So definitely talk to your physician about getting screened earlier. Other things include being African American, living a very sedentary lifestyle. In particular, lots of alcohol intake, smoking, obesity. Those are all risk factors. And one that you might not think about is diabetes. And in fact, a meta-analysis of 14 studies estimated that the risk of colon cancer among diabetics is 30% higher than in non-diabetics. Very low fiber and high meat intake is another really high risk. Processed foods and in particular meat, sausages, bacon, ham, beef, jerky, corned beef, smoked, salted, fermented, and cured meats. These are the ones that really put you at risk. There's something called nitrates, which are converted into nitrites and then into known carcinogens. And in fact, the International Agency for Research on Cancer actually came out and said very explicitly that processed meats, again, sausages, beef, jerky, all the cured smoked meats, were actually a group 1 carcinogen, which places these foods in the same risk category for cancer as asbestos, cigarettes, and alcohol. And in fact, the World Cancer Research Fund has published data in both 2015 and 2020 that estimates for every 50 grams of processed meat consumed per day, the risk of colon cancer increases by approximately 16%. That's colon cancer. So remember, get screened with colonoscopy, up your dietary fiber, and forget the processed meats. I'll see you next time.